Lung cancer is our nation's second most common cancer and our most lethal. But with proven early detection tools, we can find lung cancer sooner and help save lives. In honor of Lung Cancer Awareness Month, Dr. Donald Norwood, CARTI'S Medical Director of Imaging, is here to talk to us more about early detection and some of these tools we're talking about. Thank you for joining us today.
Good afternoon. Thank you for having me.
So let's start with, when we say early detection, we say that for a lot of different types of cancers, that is so key to get that early detection. But why is it so important, and especially with lung cancer?
Too often lung cancer is detected when it's in its advanced stages and causing symptoms. With early detection and improved treatment options, we improve the survival. And lung cancer survival in the state of Arkansas has improved over the last 5 years by 25%. Great.
Wow, that's 25%. That's incredible. So what do we have at our disposal for early detection?
We have, our most important tool is the low dose screening lung CT, which is a CT examination that uses a lower dose of radiation to acquire the exam.
Okay. So I know that probably not everyone needs one of these scans in order for early detection. And I know that, guidelines recently changed as well as who should be getting these scans?
Correct. The American Cancer Society has expanded their number of people they believe qualify for getting annual screening examinations. They say now that age 50 to 80 with at least a 20-pack year history of smoking, regardless of whether you've stopped smoking or not.
Okay, so in their lifetime, if they meet that threshold.
Correct.
And so I know CARTI has a lot of resources at your disposal, of course, to do these scans. I know that besides just making an appointment, there's also events that you guys hold as well.
Yes, in honor of Lung Cancer Awareness Month, we're having a special Saturday screening appointment this Saturday, November 18th from 9 to 11 at our main cancer center here in Little Rock.
Perfect. So that way you can go do that. There's all the information on your screen, by the way. But then, of course, if you can't make that event, you can always just call if you meet that threshold, if you're in that age range, and then book your screening regardless.
Perfect.
And then finally, as we talk about lung cancer, is there anything people can do now that can help them in the future to either, lower their risk of lung cancer? For example, if they're smoking currently, is stopping going to be a big change for them?
Yes, smoking cessation does have an impact on your overall risk, your lifetime risk. Of course, not starting in the beginning would be a key. The smoking actually increases your risk somewhere around 10 to 15-fold.
Wow.
So,
yeah, that's one way that you can help your lifestyle and affect that right now, so that you don't have to then go and have to deal with all the screenings and all the craziness that comes with that diagnosis later on.
Yes.
Well, thank you so much for joining us today and sharing about Lung Cancer Awareness Month and how you can get these screenings. And remember, if you meet that criteria, if you fall in that threshold, please go schedule your screening. You can do so during that event that we just mentioned, or whenever you are free. CARTI is more than willing to help.
Yes, ma'am.
All right.